Tune in every Tuesday evening here on The Music Class. Let the music class begin.
JustCom Music Ministry, your daily dose of inspiration. Follow JustCom PH on Spotify and JustCom Music on YouTube. We are also on iTunes and Deezer.
Listen to songs and artists you didn't know you'd like. This is the Indie List on Radyo Katipunan 87.9 FM. We all want to live healthier in mind, body, and spirit. But where do we start? Sometimes, all it takes is a good conversation. Tune in to Wellness Wednesdays on Radyo Katipunan 87.9 FM. Together with experts, inspiring guests, and real stories, we explore tips you can actually use. From managing stress, to eating better, to finding balance in a busy world. Because here, we believe wellness isn't just about living longer, it's about living better. So join us, and let's make every Wednesday a step toward your healthiest self. Wellness Wednesdays, wellness that speaks to you. From the body, mind, to mic. Every Wednesday on Radyo Katipunan 87.9 FM.
Checking out the latest happenings in, around, and beyond Katipunan. This is the Katipunan Roundup.
Get ready for peak entertainment and an auditory experience like no other. The Contemporary A Cappella Singers Association invites you to GrandCon 2026 Zenith. Experience a cappella renditions of your favorite pop and rock anthems, from Queen to the Eraserheads, and featuring legendary guest artists. OPM rock band Join the Club. Catch the performance live on May 22 and 23 at the Rizal Mini Theater in Ateneo de Manila University. Tickets are available at bit.ly/GrandConZ. That's capital GRAND, capital CON, capital ZENITH. For more information, look us up at facebook.com/musicacasa. That's MUSIKACASA. Casa's Grand Concert 2026 Zenith. Get your tickets today.
The voice of the Blue Eagle. Radyo Katipunan 87.9 FM.
This is Radio Katipunan 87.9 FM. The voice of the Blue Eagle.
Coming up next, Cura, conversations on care, health, and healing on Radyo Katipunan 87.9 FM.
Radyo, 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 Katipunan. Radyo Katipunan. Radyo Katipunan. Radyo Katipunan. Radyo Katipunan. Sa Blue Eagle kami di mapipigil sa pagbabalitang sa loob sa labas ng eskwela, ating ibibida lahat ng kwela. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. gimnasyo, katipunero, sugod, todo sa kayo, tulong at tulog, lipat na pumigil, kalinggiti nagiging, and white, one big fight. Radyo, 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 Katipunan, radyo, 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 Katipunan, radyo, radyo, Katipunan,
Health isn't just about medicine,
It's about care
community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion
Where care meets conversation.
Magandang gabi, Ateneo, and welcome back to another episode of Cura Conversations on Care, Health, and Healing. I'm Dr. Tipi Sumpayco Tanchanco.
And I'm Dr. Jello Apostol. Welcome back, Dr. Tipi. Na-miss
It's
ka
nice to be
namin.
back. Na-miss niyo ba ako? Oh, na-miss ko
We
rin kayo.
missed you deeply.
Yes,
But,
yes.
Dr. Tipi, tonight we are bringing our listeners on a very special and deeply important episode, no? Ngayong buwan ng Mayo, Dr. Tipi, the entire global medical community is observing a very significant health event. And hopefully, in this episode, we will shine light on what many people have called to be an invisible illness.
Invisible illness, yes, Doc Jello. So, every May 19, the world comes together to observe World Inflammatory Bowel Disease Day, or IBD Day, no?
IBD.
Kaya naman, right at the top of our show, we want to give a massive warm greeting to this incredible, brave community of parents, advocates, and families of the Crohn's and Colitis Philippines. So ito po ay isang support group na na-form 2017 ba? 2017, no? 2017 na-form itong support group na ito.
And speaking of the Crohn's and Colitis Philippines support group, hello po no sa mga miyembro ng Crohn's
Magsha-shoutout
and
tayo.
Colitis
Yan.
Philippines support group. But before we proceed with our discussion, Dr. P, we would also like to take this solemn moment to express our deepest and most heartfelt condolences to the Crohn's and Colitis Philippines group, and also to the family of the Bartolome and Ramos family, because Dr. P, just a few days ago, last May 3 to 2026, the community, the IBD community, they lost a bright light, the co-founder and president of Crohn's and Colitis Philippines, Ms. Nicar Noemi Bartolome Ramos, joined our creator very recently.
Right. So, si Miss Nicar po is the daughter of former PNP Chief Nicanor Bartolome and si Dr. Noemi. I think they're listening right now. So, we extend our heartfelt condolences po to the family as well, no? So, heartbreakingly, her long battle with Crohn's disease was discovered to have progressed to stage 3 rectal cancer. And ang bilis po, February lang daw nangyari to, no? So, her passing is a profound loss to the community that she has helped build. But, sobrang pasasalamat po ng mga families, ng mga advocates na natulungan ni Nicar.
And, definitely, Dr. P, hopefully we can dedicate our episode tonight to her memory, but also to the lived experiences of, many Filipinos who apparently are living with this invisible illness, but are also enduring with bravery and grit
And
resilience.
Resilience talaga,
Okay,
yes.
and as we will learn tonight, IBD is a chronic and often invisible condition. And later on, we will also discuss why cancer surveillance, so may IBD tapos you have the big C pa, is an absolutely critical part of surviving this disease. And again, our conversation today in honor of Ms. Nicar's journey and the many Filipinos who are fighting through this invisible illness.
Right, so dedicated po talaga para sa kanila itong episode natin to. So, ito naman, to give this condition the deep masterclass discussion that it deserves, we have invited an expert po in the field of gastroenterology. He completed his residency and gastroenterology fellowship at the Makati Medical Center, where he also served as chief fellow. So siya po yung boss ng mga GIs natin doon, no, na nagte-train. He then traveled to Tokyo, Japan to train in endoscopic ultrasound and ERCP at the National Cancer Center Hospital. And right now, maraming salamat at bumalik siya sa Pilipinas. He is furthering his expertise through an advanced inflammatory bowel disease fellowship at the Schulich, tama ba yung pag-pronounce ko, Doc? Schulich School of Medicine and Dentistry at Western University in London and Canada.
And not just that, Dr. Pino, he's also a fellow of both the Philippine College of Physicians and the Philippine Society of Gastroenterology. Please welcome to Cura, Dr. Mark Paulo M. Chatto. Hello, Doc Mark.
Magandang gabi, Doc
Good evening.
Mark. Ayan.
And, also joining us, no? Kasi, nabanggit nga natin kanina, like, this is a really very challenging, invisible illness. And we are very thankful to have with us today, someone with lived experience, to tell to us like what it's like to be living with this invisible illness.
So ito yung kwento talaga, yung stories na gusto nating madinig, no?
So joining us today, Dr. P, is a patient advocate, from the Crohn's and Colitis Philippines. We also have with us Miss Anne Gayanilo. Welcome to the show, Miss Anne.
Good evening.
Magandang gabi po, Doc TP, Doc Jello, and hello, Doc Mark. Thank you so much po for having us tonight. On behalf of Crohn's and Colitis Philippines, thank you for this feature as we celebrate the World IBD Day. And we appreciate your tribute for our co-founder and president, Ms. Nicar Bartolome Ramos. Our community is grieving with her passing because she is a huge loss. But it fuels our fire to spread more awareness about this condition. So thank you po and hello po.
So we'd like to assure you, Miss Anne, that we are with you in this fight, no? And before we deep dive into the medical side of things, Doc Mark, ito yung lagi namin ginagawa sa lahat ng mga guests namin, no? So we always love getting to know the person behind the scenes, sa mga guests namin, tinatanong din namin to. So, nakita namin sa track record mo, you trained in Tokyo, and then you went to London, Canada, doing advanced IBD fellowship, no? So, out of all the fields in medicine, bakit naman GI yung pinasok mo at saka nag-subspecialize ka pa sa IBD? Kwentuhan mo naman kami.
Yeah, so originally I didn't want to be a gastroenterologist. I didn't think of being a gastroenterologist. In med school, I was thinking of surgery. Then after med school, internal medicine. I always liked internal medicine, so I went into medicine because my sister had lupus, so it's an autoimmune disease. When I was going through residency, I was thinking of interventional cardiology because I wanted procedures. But then I realized I wanted like a broader perspective of medicine, I guess. So I was thinking GI, but also wanted to do procedures. So that's why GI.
So parang perfect combination.
Yeah, of all the organs, 7 organ systems under GI, 7 organs under GI, and then
dami pala, no? Seven pala. Kasi kung cardio isa lang, puso lang, no? Kung GI, mas marami kang options.
Oo, kasi di ba pag mag-order ka ng ano? Marami, di ba? Chicharon bulaklak, di ba? Yung mga ilalagay sa goto, tama ba yun? Or no, kidding aside. No? But now I turn over to Miss Anne. Miss Anne, you are a patient advocate, no, representing Crohn's and Colitis Philippines. But, before we get into the details, anong kwento mo? I mean, like, who is Anne as a patient advocate? Who is Anne beyond being a patient advocate? And how did your journey with IBD start?
I was diagnosed po at the age of 20.
20 years old.
That was in 2012. So I have been living with Crohn's disease for 14 years now. So when I was diagnosed, I was working as a medical technologist. So
health field pa rin, no?
Yeah, health field, but it's hard because you're in the healthcare and then you're diagnosed with IBD and then the symptoms started. There is chronic fatigue. I lost 10 kilograms in a few weeks. There's bleeding, diarrhea, and even mouth sores, Doc, I had. And then they don't know really what's happening with me. So I have undergone a lot of tests and then diagnostic procedures. But then it was hard that time to trace what's happening. So severe yung abdominal pain and continuous po siya. So, yun po yung mga initial symptoms, like very persistent.
Yeah.
Pero kumusta ka na ngayon, Anne? How are you 14 years into this journey with IBD?
Yeah, like I've said, no, parang I think I've matured as a patient because this is a chronic, lifelong condition. So as you go through different phases, you mature and you get to navigate the condition and you get more familiar, and I'm currently doing well with my medication.
Ang galing.
That's really nice
At
to
saka
know.
parang going beyond yourself, you're actively like heading this group of parang
Advocates, patient advocates. Like,
Yeah.
really patients taking healthcare to their own hands.
Right.
And di ba, yun
ang
din
goal
ang-
naman natin talaga, di ba?
Correct, di ba? Yun yung goal ng Cura. Parang hindi lang sa mga doktor, di ba? Even patients can advocate for their own care, health, and healing.
Yes, and I think that's important talaga. So, yun talaga yung dahilan bakit tayo nandito, no? So, let's start with the basics. Ano nga bang IBD, Doc Mark? At saka, paano natin to? Kasi di ba, IBD, Inflammatory Bowel Disease, lagi nating naririnig, IBS din, Irritable Bowel Syndrome. Pareho ba to?
Yeah, so they're two different separate conditions. So IBD, inflammatory bowel disease, it's an autoimmune disease where your body attacks, inaatake ng sarili mong katawan your immune system is attacking its own self. So in this case, for Crohn's disease, so there's two sister diseases. Crohn's disease and ulcerative colitis. Yung Crohn's can happen anywhere from the mouth to the anus. So all tracts of the gut are involved. Ulcerative colitis. So the colon lang yung involved there. So they just differ in the behavior of the disease. So Crohn's, tumatagos yung inflammation through and through the tissue of the tract. So kaya nagkaka-fistula, kaya nagkaka-stricture. For ulcerative colitis, yung top layer ng tissue yung namamaga. So they can cause those kinds of problems, and they're really very long term. IBS is more of a disorder of the term will be changed like later this year in 2026,
May bago na siyang
27.
pangalan.
Yeah, so well, it's not a new name, but the umbrella term is a disorder of gut-brain axis. So it's more of misperception or firing of the nerves in your gut without really inflammation or those things.
Okay, so magkaiba sila talaga at hindi natin dapat na-interchange yung IBD sa IBS, no? Sige, pero parang ibig sabihin ba nun? Kasi parang dinescribe nyo, Doc Mark, magkaiba yung ulcerative colitis at saka Crohn's. Ibig sabihin ba na mas malala yung Crohn's kaysa sa ulcerative
So
colitis?
both diseases, they have their own severe, they can be very severe in their own right. So the only difference is the behavior, yung kung saan siya namamaga and which area. So like for example, in its most severe, yung ulcerative colitis, maoperahan ka, matatanggal yung colon mo. And then if you remove the colon, basically na-cure na yung disease. For Crohn's, if you do surgery on patients, pwedeng babalik-balik lang din kasi anywhere na apektuhan yung...
Hindi ba naman pwede tanggalin lahat?
Yeah, so yeah, mamatay din yung patient like, in that case.
Alam mo ko, Dr. P and Doc Mark, and perhaps Miss Anne can also chime in. Like the first question that our listeners always ask, and perhaps many patients would also ask is, masakit ba? So let's start with that. I mean, like, masakit ba ang magkaroon ng inflammatory bowel disease, ulcerative colitis, Crohn's disease? Is there like physical pain and suffering that comes with it?
Yeah, a lot of pain. Like, majority po, talagang abdominal pain. And then, yung fatigue, talagang walang energy. Then, yung fatigue na dadagdagan pa kasi there's chronic diarrhea. And then, hindi mo malaman bakit ka nagda-diarrhea, wala ka namang nakain or nakakaiba or something. So, talagang mahirap siya, and then mas nagpapahirap yung hindi mo alam kung ano yung nangyayari sa'yo. Like, you're going to several doctors, and then syempre minsan, kunyari, akala mo masakit lang ulo mo or yung mouth sores mo, something na ano. Pero yun
Stress
pala,
lang,
yeah, akala mo
lang.
singaw lang,
Nakagat mo.
dentist, ganyan. Pero yun pala, connected din siya dun sa, nangyayari dun sa'yo, sa katawan mo. So, yun po. Mahirap siya, maraming napapagod. Like in our support group, talagang all the pain, kaya nga po, we're providing safe a safe space for them where they can share what they are going through. And then some patients nag-share sila na, ay, naranasan ko din yan, ganyan. And then kapag naririnig nila, kahit paano, hindi man ma-relieve yung pain, but at least psychologically and mentally, natutulungan silang maging at ease and mabawasan yung stress because stress is also a major factor sa triggers ng disease po.
So you're not alone in the pain.
Hindi sila nag-iisa, no?
Yes.
Oo, yeah. Pero yun din ba yung usual symptoms, Doc Mark, na nakikita nyo?
Yeah, so inflammatory bowel disease is not just a disease of the gut. No? Yung common is the abdominal pain, diarrhea. Diarrhea is most common for Crohn's, and then bleeding, weight loss. But it can affect so many other parts of your body, the joints, mouth sores, the skin, they can have rashes, the eyes, they can be affected also. So, and then it extends to your other areas of life. The psychologies, the mental health issues are common, anxiety about relationships or, having children, fertility issues. Those are all parts. So everything that Anne said, parang that's all part of the IBD. So it's really important to have a support group. And the treatment that's why the treatment is so crucial, because when you settle all these, the inflammation, they can really move forward with a normal life and not feel like they are sick or in pain.
Right. Doc Mark, ano ba yung usual age group na naapektuhan nitong IBD? Is there like a particular age group na, sige, at this age, I suspect, baka IBD yan versus if it's in another age group?
In terms of suspecting the disease, the symptoms that Anne described, they're classically already, you should suspect IBD, the weight loss, the diarrhea, blood in the stool, at any age. So,
at any age,
so
children.
So some children can be diagnosed as young as 6 months. There's a peak, and then older people
Baby
can also
pa lang,
be.
may ano na.
So
Oh my
when I
gosh.
trained in Canada, that's the youngest they diagnosed.
At 6 months?
Yeah. So
Parang diarrhea na siya and
failure to thrive,
Failure to thrive,
yung ganon. So and then
presentation.
so I don't know how they scope that baby,
Oo
pero
nga.
pero
Pero ba baby scope kasi kung ganon.
yeah, so parang there's two general, statistically speaking, 15 to 30s, and then there's another peak at a bit older. But it's not just because they're outside of the age group that you should ignore or not consider it. So when you have the symptoms that you described, that Anne described, you should already think of that as being part of, is this a possibility that your patient has? Because every delay in diagnosis will make them suffer. Everything that she said, that's very.
But really, anyone at any age across the life cycle. Miss Anne, I'd like to ask, in your support group, kasi parang may insight din kayo, kung sino yung madalas or kadalasang naapektuhan. Like, are they mostly young people like you, Because you said you were diagnosed at 20. Are they mostly old people? Meron din bang mga pediatric patients in your support
nag-aaral ka
group?
pa ba nun, nung na-diagnose ka?
Luckily, kaka-graduate ko lang po. I was starting to work. So, nag-work na po ako noon.
Pero ang hirap no? Kasi parang you're just like starting with your life.
Or
You're in
siguro
your
kung
productive
teenager
prime.
ka.
And yung mga kasama mo, they're at the peak of their youth. And then, ikaw, pabalik-balik pabalik-balik yung symptoms mo. So, yung age group naman po, as we have observed in our community group, karaniwan po nasa working manpower na. But we have a lot din po na pediatric patients. That's why in the patient support group, we have a lot of mothers there. Na sila yung very dedicated po sila. They are the ones who are researching about IBD and then asking for treatments kasi very worried po talaga sila dun sa mga anak nila. So, sila po yung mga nagtatanong and all. So, dun po sa community support group namin, not only the patients but also their family members are included. Pero yun po, marami talaga nasa working manpower and they're worried because they are working. How are they gonna do with their life? Pag nag-diagnose sila na IBD, parang nagpapanik sila kasi nga maraming dapat isipin.
Nagpanik ka ba nung na-diagnose ka? Like, ano naisip mo nung sinabing, may IBD ka? O may Crohn's ka?
Well, at least alam ko ano na yung treatment. Yun yung naisip ko mo dun. Kasi for the longest time, yung symptoms ko hindi ko maintindihan. So when I was diagnosed, kahit paano, at least I know what's happening with me. Kasi sometimes they're skeptic na IBD does not exist here because it's more common in the Western group. So at least yun. But then I have a lot of questions. Pero ang pinaka-concern ko po talaga as a patient is how do I get to ease sa pain.
Kasi masakit, no?
Yeah.
So may physical pain and also may social pain, which hopefully we can also discuss later. Pero Doc Mark, balakin ko yung sinabi mo kanina, no? Parang you mentioned that we are starting to observe that the rates of those with IBD, the prevalence is increasing. So dumadami. And apparently in the Philippines, based on the data pala, Doc Tipi, and perhaps Doc Mark and Miss Anne, you can confirm this, it's mostly in urban areas. So tayo na nandito.
Ipapakonfirm natin.
Tayo na nandito sa mga syudad, sa mga city.
Correct. Higher ba?
Is it higher as compared to rural areas? Right. Is that what we are observing?
Pero pwede ba ako mag-reveal muna? Alam niyo po, nung nasa med school ako, sabi nila, walang IBD sa Pilipinas. So parang, kailangan ba yung aralin for the exam? Kasi parang ang sobrang baba ng burden of illness. Yun yung kwenta nila. Tapos biglang, ay, meron ng isang case. Ay, parami na ng parami.
Tsaka, Doc, syempre, tatanungin din natin, anong year ba yan?
Yun nga, oh my gosh, okay. Pero ganun po, yun ang aking reveal. Nung panahon ko, sabi nila, pang states lang yan, kaya di nyo kailangan aralin. Pag mag-MLE ka, tsaka mo siya aralin. Pag local boards, wag daw. Ganun siya ka-rare dati. So ano ba ang stats natin ngayon, Doc Mark?
And bakit dumadami? Kasi nabanggit din kanina ni Miss Anne, parang like yung western areas and cities. So parang, what could probably explain that?
Yeah, so nobody knows the actual cause of IBD, but they did do a study na parang it's a combination of genetics, environment, and the way both will affect, we have our microbiome, we call it, so bacteria, viruses, yeast inside our gut that will eventually trigger the cascade of inflammation moving forward and make patients sick. So initially, as Dr. Tipi mentioned, it only happens in countries where white people live, or because they were the first countries that industrialized. But later, Japan, Korea, and then Malaysia, Colombia, Brazil, they're all also increasing. So kahit mga developing countries, now recently there's countries in North Africa are reporting an increase also. So these are poor countries also that are increasing, and it's because of industrialization. I think we had a professor before from Hong Kong. In China, so just like you described, they hardly saw any cases. Now they can hardly keep up with the number of cases that are happening, because I think you mentioned
case finding ba?
I think it's awareness also. So that's maybe why you see it in more urban areas, because the doctors are concentrated in urban areas, or maybe the diet is also different, the environment is different in an urban area. What we eat is different. It's not as natural, processed in boxes, fast food. So that will all contribute potentially to the rise in IBD cases.
Alam mo, Dr. P, that's really a point of reflection for us and also for our listeners. But when we reflect on what we're eating in the past week, how much of it was natural, home cooked, and how much of it is, to Doc Mark's point, came in boxes, fast food, we don't know, canned, ultra-processed, with all of the plastics, no? I mean, although, sabi nga ni Doc Mark, we're still trying to understand what really causes it, no? But we are seeing some patterns, ang nakikita natin na link is really our lifestyle talaga, no? The way we eat, the way we live. Ako, Doc Mark and Miss Anne, you talked about pain as one of the defining features of IBD, but we get stomach pain naman, di ba? If we ate something funny, or say for example,
or marami ka masyadong
kinain. But what would you say is unique about the pain of IBD?
Or mati-differentiate ba yung pain na yun?
Sa akin po kasi, in most patients, talagang persistent siya eh.
So, kahit tulog ka?
Yeah.
Magigising
and sometimes
ka?
mahirapan ka makatulog because of the pain.
Tapos saan? Saang parte ng tiyan mo masakit?
Iba-iba din. Maybe depends kung ano yung affected part sa'yo, ano yung namamaga. But usually, like sa akin, right ascending colon kasi yung, so usually yung pain ko is in my right part ng abdomen ko. So, yun po. Then, yun. Usually po talaga, any part. Pero sa akin, sa right, I don't know with some patients. Pero, yun po. Depends kung ano yung namamaga na part.
So usually, to differentiate yung just pain from regular IBS or something, well, Anne described earlier her symptoms. So other symptoms can all happen. If they've been occurring for months na, several weeks, months, you're having weight loss, blood in your stool, I think it's time to have yourself checked. Kasi as a gastroenterologist, we cannot guess kung saan namamaga until we take a look with a scope, with an endoscope. So I know it's a very expensive procedure here in the Philippines, especially don't have an HMO. But
ba covered
looking,
yun?
so well, it's covered by an HMO, but if you don't have HMO, PhilHealth will only cover partial. So it's not going to be, unless you're in a yakap center na parang screening colonoscopy, but symptomatic young patients, they still have to pay
May out
a
of
substantial
pocket pa rin.
amount. So that's the way our healthcare system is.
Mga ilang
designed.
zeros kaya, Doc
So,
Mark?
May bang
Without
ballpark
any-
figure?
Limang zeros?
Yeah, so,
Limang zero.
so,
Para madaya.
Hindi, 5 figures or limang zeros?
Five
Five
figures. Sorry,
figures.
four.
Madami
Four
pa rin yun
Pag limang
Four
zeros,
zeros.
ibig sabihin 6
Sorry,
figures na
mali
yun.
yung math ko.
Naku,
Kaya
ang
nga,
parang
Dr.
yaman
Benedict.
siguro ng mga gastroenterologists natin, no?
Kaya, oo nga. Pero 'di ba sinabi mo rin, Doc Mark, so kailangan ba yung gastrointestinal symptoms may kasabay na sintomas sa ibang parte ng katawan para ma-diagnose?
Not always, but a lot of times they have other accompanying symptoms. So basically for chronic abdominal pain or unexplained weight loss, chronic diarrhea, yung parang several weeks and months na, magpa-check na kayo sa doctor niyo to see. It doesn't necessarily have to be IBD,
Right.
but definitely it's worth asking a doctor, what your
How
conditions
long should
are.
they wait? Kasi halimbawa may diarrhea, 'di ba? Parang baka may nakain lang ako.
Yeah, so
Kailan?
usually a few days is just and you're back to yourself. That's
Okay,
most
yun.
acute diarrhea will resolve on its own without medicines. Just hydrate properly, over the counter yung Hydrite. So, but if it's been lasting several weeks and months and you're having other symptoms, you really don't feel that this is just an infection. This is just something that it's just IBS. So it's always worth asking your doctor so they can evaluate you properly.
So, parang when in doubt, wala namang mawawala sa'yo, pa-check ka na lang. Gaano katagal ka nag-antay bago magpa-check up?
I guess a month. Yeah, a month.
Tagal-tagal din,
Yeah, a month. Because, akala ko pagod lang ako because I was in the healthcare field eh. So, akala ko pagod lang ako.
Nag-duty ka no? Ng time
Yeah,
yun?
yeah. So, but, we've noticed din po na recently, mas mabilis nang nadadiagnose po ang IBD patients, maybe because of the awareness din. But in my time kasi, in 2012, that was 13, 14 years ago. So, ayun po, talagang medyo maghihintay ka pa ng onte. Pero ngayon po, mabilis na. Like,
Gaano kabilis yung mabilis?
yung kwento po ng karamihang patients, like yung iba nagsisymptom sila ng 1 month or 2 months, then IBD na. Then magte-treatment na sila.
Oh, so that's really very encouraging.
Pero,
Mabilis na.
Doc Mark, ilan ba kayo na IBD experts sa Pilipinas? Alamin din natin ilan yung mga doktor. Pakikwento naman, Doc Mark.
So I think Dr. Soliano, he was the one who really he's not formally trained, but he has been studying and been involved with all the patients for the last 30 years.
30
And then there's 3 of us now who are currently formally trained.
3.
Yeah.
For the entire Philippines.
600 plus gastroenterologists. And I think there's 2 more or 3 more currently training in IBD. There may be some more interested in the future. Pero it's not something that a lot of people kasi are interested in because it's also a tricky and challenging and toxic disease to deal with. So, yeah.
So, ayan. Promotion din po itong episode na to, no, sa ating mga gastroenterologists.
Sa ating ding mga medical students, baka gusto nyo
mag-specialize no, sa IBD.
gastro,
Especially since nabanggit nga kanina, we're seeing that the trends are
Tumataas
increasing.
kasi, no?
And with the
Yeah.
rate that we're going, with the kind of lifestyles no, that we are leading, Dr. P, then parang yun nga, no, parang similar to what other countries are experiencing, baka it might outpace us, di ba? Alam mo, Dr. P, before we continue, we talked about the physical symptoms, no, like the pain, the fatigue, the sores, etc. But perhaps, and really just to also honor the lived experiences of our patient survivors, what are the social symptoms? Like, siguro I'd like to ask Anne, and perhaps si Doc Mark can also chime in, like, saan kayo pinaka nahirapan? Like, when it comes to, I mean, I guess off the top of my head, was it easy for you to, kasi may panahon ng bakasyon, di ba?
Bakasyon.
Road trip.
Pupunta sa beach,
Pupunta sa
ganyan.
beach,
O
no?
mag-airplane.
Mag-airplane, di ba? Or How about love life, di ba? Nahirapan ba? So, like, for you, Anne, like, what was the most difficult part? Like, beyond the physical symptom, what was the most difficult part navigating your life with IBD?
Yeah, maybe it's missing the events, the important events. Like, sabi nila nga, and most of the patients share this with me din, na parang andyan ka na, planado na lahat, but when that day comes, mag-flare ka or magiging symptomatic ka. So, you have to cancel that. Kasi kapag ka tinuloy mo pa, lalo kang mahihirapan. Like, kunyari, yung one day mo na mapapagod ka, mapapalitan siya ng 1 week na, kailangan mo magpahinga. So, with the relationships naman po, majority naman po, medyo normal
Kwento mo nga ang
naman.
love life mo.
Majority of your relationship, parang ang dami.
Majority of the patients.
Sandali, ingat tayo dito. Pero sige.
Opo.
Kwento naman dyan.
Majority of the patients naman po, normal naman yung relationships nila. Personally po ako, I'm lucky kasi I met my husband early. So we were together since high school, even if I was not yet diagnosed.
Hindi ka pa diagnosed, kayo na.
Yeah, so...
But like, I can imagine how difficult it must be to also, I guess, disclose that and share that aspect of you. Did you have difficulty disclosing and sharing that aspect of who you are with your significant other, with your family?
Yeah. Yung hirap nung pag-disclose, maybe sa social, kasi like sa work. Because sometimes they will judge you eh. Or minsan kasi, because they don't know. Yung iba kasi, ano yan? Cancer? Ano yan? Pag narinig na nila yung colon, namamaga kasi may inflammation yung colon ko. Ano yung colon cancer? Parang yun lang yung alam nila. And then, when you say Crohn's disease, ano yun? Parang gano'n.
Kailangan pa explain.
Yeah, kailangan mo pang i-explain and all. Right. So, ayun po, yun. And then, but we're lucky po, most of the patients din kami. Kasi we have a support group and the family members and yung mga friends namin, they understand. Kapag ka mag-aaya sila, kaya mo ba? Pwede ka ba? So, kapag mag-cancel
yun yung
ka,
una nilang tanong
they are very considerate.
Kailangan talaga yung support system din, ano?
And Doc Mark, parang like given that, nabanggit nga ni Miss Anne that, there are like social implications to the diagnosis of IBD. Pero do you also see like a lot of like, I can only imagine, does it come with like mental health problems, psychosocial issues?
Yeah, so
what do you see with your patients, Doc Mark?
That's part of anyone living with a chronic illness, whether it's IBD or some other chronic illness. Everything in like your aspect, the mental health, social, they're all going to be involved. But that's why I think the goal of treating and managing this disease is to really normalize. That's part of the measures that we are treating the patient adequately, is the normalization of their quality of life.
And that's doable.
That's completely doable with the right therapy that they are going to be on. So I have some patients who we've treated in Canada. They do not remember that they have IBD except for when they show up for an infusion or when they inject themselves for yung therapy nila. Everything is completely normal. So we have 1 stool a day, maybe twice a day. They don't need to look for the bathroom. They don't feel any pain. They can do whatever. So we have some soldiers, we have pilots who are patients, so they can do anything that they like. They can travel wherever, and then they just bring their pens with them. For relationship wise, it's not just they can give birth, they can have children, and they don't need to worry about whatever. Because some patients, they have surgery, so they worry about the pain or the consequences. LGBTQIA issues are also important kasi parang syempre they will have surgery, and then like being with a partner or something is an issue. I mean, those are all things that will need to be addressed, and you can address that. So I just like to say that it's, with all the issues that you've mentioned, it's not just a gastroenterologist who will be involved in the care of an IBD patient, but psychologists are also involved, other doctors, rheumatologists, joint doctors, mental health specialists, psychologists, nutritionists also. So there's so many doctors. It's a team. It's a support group, not just of patients, but also of physicians and clinicians who will be involved.
Collaborative care team talaga.
Yeah. And so, yun nga, parang IBD is very challenging, but it's manageable. And really, the management starts with proper diagnosis. So, Doc Mark, parang we'd like to ask, parang how difficult is it to diagnose IBD? Are there some unique challenges that we encounter here in the Philippines when it comes to getting people diagnosed of this invisible illness?
I think, so I'll just echo what one of my professors in medical school said. A disease is only rare if you think it's rare. So I think the first step is for doctors to consider that the patient may have the disease. I think tuberculosis is also a problem, like Anne mentioned. They thought she had tuberculosis. And yes, it's a very difficult thing to differentiate between them, especially early on. But I guess if you experiment, quote unquote, and then treat the patient with anti-TB meds, pag hindi na sila gumaling, and then that's not TB, that's Crohn's.
So, ibig sabihin ba, sa huli mo isususpect na IBD siya?
I think it should be one of the top considerations. If your patients have the symptoms already that, like Anne has described, all those things, parang you should already suspect. So parang kasi suspecting it will allow you to do the workup that will, confirm it. Kasi there's no single test or there's no single physical finding or history finding that will confirm Crohn's. It's really a constellation of all those things. Put them together and then they will make up the picture that you.
So siguro, Doc Mark, di ba, sige, so in terms of diagnosis, meron bang blood test that will tell me na, sige, ito, high probability na Crohn's? Or kailangan ba scope talaga yung gagawin? Like, ano yung mga patterns na hinahanap?
And Doc Mark, parang so sabi mo kanina, kailangan tignan through a scope, no? Yung bituka, isn't that definitive ba? Or like even then, like kahit makita nyo na yung loob ng tiyan, medyo hindi pa rin tayo like 100% sure na IBD na siya.
So, IBD is a chronic disease. So when you, like, for example, I'll just answer the scope first. So when you scope, when you take biopsies, sometimes kasi patients can have acute conditions, like acute infections, Clostridium difficile or something, that can cause also a similar picture with IBD. So you have to correlate with how long it has been going on. And then when you take biopsies, the pathologist will have to report na chronic na talaga yung, matagal na talaga yung inflammation. So that's when you'll sort of commit. For the blood test, there's no single blood test. The blood tests that we have are just markers of inflammation. So the CRP is they're not specific. So there can be anemia, chronic anemia, vitamin deficiencies because of the area in the gut that's involved. And then the elevated CRP. So and then there's also a stool marker to check for how much inflammation there is in the stool. So if those are all elevated, your symptoms are, they fit the description of IBD, your scope shows chronic inflammation, the biopsy show chronic inflammation, then you'll commit to a diagnosis of IBD.
Right. Gaano kadalas yan sinoscope? Kasi di ba parang invasive siya. Meron ba yung, sige, you have to do it every month, every 6 months, every year?
Tapos parang hindi lang sa scope, di ba? Parang kukuha pala ng piraso ng bituka, no?
Yeah, so just very small bites lang naman, less than half like 5 millimeters. Kurot lang talaga. That's the definition.
Hindi naman buong isaw, no? Di ba? Parang ano lang, konti lang.
Konting kurot lang. So, when you're still being diagnosed, definitely you will have a scope. And then, hypothetically, if you get treated na, it depends on the kind of medicine. But usually, 6 to 9 months after, we will check kung nag-improve na ba yung pamamaga. So it's like cellulitis, no? Pag cellulitis, it's not just enough na parang sabihin mo na wala na yung fever ko, na wala na yung pain. Titignan mo talaga yung skin mo kung nawala na yung pamamaga. So same thing with the scope. Kailangan mo tignan sa loob kung nawala na yung pamamaga. That usually happens within 6 months to 9 months. And then after that, kung magaling na, then 8 to 10 years after, that will be your surveillance colonoscopy to check for, because inflammation will predispose any tissue to developing cancer, the liver, anything. So the colon, the gut is the same thing. If it's been, if there's been prolonged inflammation, then we need to survey for pre-cancerous, pre-malignant areas.
Kailan mo kailangan gawin yung survey yun? Like si Nicar, kasi diba, was diagnosed to have Crohn's for a long time, 2 decades almost, diba? Like, kailangan ba talagang hanapin o may cancer cells na ba to? Or pati ba yung blood markers for cancers? Is it routinely done kung meron kang IBD?
So we don't use the blood markers yung CEA.
CEA.
Kasi the behavior of cancer in IBD patients is different from
Typical
yeah, sporadic colorectal cancer.
How is it different, Doc?
So it's the inflammation kasi that causes the predisposes abnormal cells. So before, it used to be 8 to 10 years after you were diagnosed. Now it's 8 to 10 years after you were first symptomatic. So yeah, if you've been symptomatic, if you were 13 years old but you were symptomatic at 10, then at 18 you should start to have a surveillance colonoscopy. And the surveillance colonoscopy interval depends on whether or not your parents or your siblings have a history of colon cancer, because that will make it every 2 to 3 years. If you are average risk, no family members or no previous scope of a precancerous change in your colon, then every 5 years. If you have an autoimmune condition of your liver called primary sclerosing cholangitis, that's every year. You have to take a.
Pwede kasabay. Meron ka ng Crohn's, meron ka pang liver problem.
Yeah, so that is a condition that can happen with, especially with ulcerative colitis. So that's why parang we have to be very thorough in evaluating patients.
So para mga magpipinsan pala sila na sakit, no? Ako gusto ko rin tanungin si Ano kasi nabanggit nga kanina, what I'm getting from Doc Mark is that it's not your usual disease to diagnose, no? Parang like you really have to follow through it. You have to look at other symptoms.
Right.
I suppose there are also risks of misdiagnosis. I'm not sure how often is that, no? Parang like when you look at your own experience and like when you look at your community, marami bang na may misdiagnose na pasyente na sabihin natin, una akala TB, then they take the meds for 6 months as walang nangyari. Like, what do we see a lot of that happening in the community?
Yeah. Medyo common siya, but yun nga, tulad nung sinabi ko kanina, recently, mas mabilis na sila mag-diagnose as compared to our time before. But pag narinig namin na una akong na-diagnose ng TB and then after treatment, tsaka na-diagnose ng confirmatory for IBD. So parang gets na namin yun. And sometimes po, baliktad naman. May mga cases din na IBD yung unang diagnosis, but then TB lang pala.
Ayun. So it happens naman pala.
Nangyari din yun.
Doc Mark, no? Parang yung siguro, can we spend a bit of time and very quickly explain to our listeners, how does IBD become cancer? Like, what actually happens? Di ba? Parang, kasi we talk about...
You mean sa mga cells?
Di ba? Like, what's happening in the body? Kasi di ba, it's inflammation, namamaga. Namamaga naman yung katawan natin. Pero, kunwari, nagkasugat ako, tapos namaga siya.
Yeah.
Pero hindi naman siya magiging cancer, di ba?
Tanong ka rin kay Doc Mark, ilang percent yung nagko-convert? Like, lahat ba ng may IBD, high risk na sila talaga magka-cancer? 80% ba? Or 5% lang?
So overall, because of the therapies that have been coming in the last 10, 20, 30 years, the risk of cancer developing from IBD is decreasing. I think there's, kasi the chronic inflammation will be the one that will predispose. So yung pamamaga, like the usual pamamaga, it's just for a short while. But if your inflammation has been going on for 10, 15, 20, 30 years, I think Niccar had hers for almost 20 years. So there's an 18% chance of having a risk of having that one. So the risk increases the longer you have been having IBD. In general, that is uncontrolled. Like, kung hindi na control yung inflammation, if you weren't treated early. So, I think one of our principles in IBD management is the early diagnosis, early treatment. So, within 1 year, you should have controlled the inflammation to decrease the risk of further developing the complications, including cancer.
So, kumbaga, pwedeng doon lang siya, hindi siya lalala. It's also possible yung in terms of a timeline, it becomes stable. Hindi siya degenerative na, okay, it becomes worse and worse. Hindi naman ganun.
Yeah, so as long as they get treated properly and on time, then they can completely have a stable prognosis in the future.
Thank you. Meron tayong, ito si Mami Lizelle. Hello, shout out kay Mami Lizelle. Meron siyang question for us, no? So for surveillance colonoscopies, kailangan ba talaga na may biopsy all the time? Or parang sisilipin mo lang ba yun?
So we have two kinds of colonoscopies with IBD. One is to assess the disease, meaning your response to treatment. So if we're just assessing your response to the therapy, we will not take biopsies. But if we are doing the surveillance, when we say surveillance, that means you have already been living with IBD for 8 to 10 years or more, then yes, we need to take biopsies because that's how we catch the possible
conversion to
converting.
a cancer.
So it's not necessarily cancer that you will catch, but when you read in the report dysplasia, meaning there's abnormal cells that are maybe precancerous, low grade or high grade, then that will already be a trigger to watch you more closely. So we need to take biopsies definitely.
Right. So important talaga yung surveillance na tinatawag natin. I think yun yung message mo din, Doc Mark, no? Yung surveillance.
And yung silver lining dito, yung sinabi ni Doc Mark na parang if it's diagnosed early, then you can treat early as well and you can manage it and prevent that risk from happening. So, Doc Mark, let's talk about treatment, no? Ano po ba ang treatment dito sa very challenging and very elusive na sakit na ito, na IBD?
So there's, it depends on how severe your case is. So if it's mild Crohn's or mild UC, you can get away with topical medications lang. And these medications are, yes, expensive, but they are generally affordable. If you're already moderate to severe, so what's the definition? So malala yung inflammation in the endoscopy. Buong colon yung involved, no hospital ka, na surgery ka, you needed IV steroids or even oral steroids. That's already moderate to severe. And if you have several flares or attacks in a year, then definitely we have something called biologics. They're not.
Sige, pag-usapan natin ang biologics, Doc.
The biologics are the reason why they're called biologics because they're not like synthetic drugs na parang they're synthesized from they're basically substances derived from live cells. So like enzymes or hormones, they're basically molecules that come from live cells, and that's why they're called biologics.
Right.
And then each batch of biologic is marginally different from the previous batch. So because they are derived from live substances. So these biologics, they suppress the immune system or certain molecules of the immune system. They don't suppress all. What suppresses all is prednisone, yung steroid. But we only use prednisone for short term, like 2, maybe maximum of 3 months. Hindi pwede masyadong mahaba because we're also weighing the adverse effects. So prednisone has the worst adverse effects among all the immunosuppressants. So that's why we use biologics, because they have the least or less adverse effects, and they're generally safe and tolerated by patients.
Right.
The downside is they're very expensive.
Yun nga, Doc Mark, sobrang mahal. Pero ito muna, meron tayong question kay
Bangs G.
Kay Bangs G. Wow, okay. So question for Doc Mark, what's your take on patients taking biologics? How long should the patient take these meds? Will we follow the strict rule of 8 weeks?
Yeah, so
Gaano katagal ba yan, Doc Mark? At saka sabi mo nga kasi mahal.
Yeah, I'll divide that into yung 8 weeks and then the how long. So, inflammatory bowel disease is not like an infection where you give an antibiotic, a course of antibiotic, na cure ka na. There's no cure for IBD, unfortunately. So, you are going to, if you were diagnosed at 13, if you live to 83, you will die with IBD. So, the disease is lifelong, and because that is so, parang they made a study, it's called the Stop It trial. They divided patients who were stable, Crohn's disease. They divided them into 2 groups. One group continued their biologic therapy, the other discontinued.
Kahit walang flares, tinuloy nila.
Yeah, so tinuloy nila kahit walang flare. They were stable for 5 years, I think. So the group that continued, they followed them up for 1 year. Halos walang nag-flare, almost zero. The group that discontinued, 50% nag-flare.
Okay,
so that's what we will. Every patient, I tell them, what are my chances if I discontinue? You have 50-50 chance of flaring. Which 50 are you? I don't know. It's unpredictable.
Parang Tosco, hindi mo alam. Pero Doc Mark, paano yan? Sobrang mahal. Meron bang move ngayon yung government? Or baka, Anne, you can also tell us, meron bang move ang government to support individuals who need these expensive biologics?
Actually, gusto ko rin nga tanungin si Anne, no? Parang like, how financially toxic is,
meron bang ballpark figure? Magkano ba yung ginagastos?
Ba? Masakit ba siya sa bulsa?
Masakit na siya nung masakit pa bulsa mo.
Oo nga eh. Parang like, ano yung nararanasan ng mga kasama mo, no, sa inyong patient advocate group? So like, gaano ba siya kamahal?
mahal po siya, like, depends po sa biologics, but it can roughly range from 40 to hundreds of thousands. And then you have
Per hundreds of thousands.
per session.
Per session.
That's every 2 months.
Wow.
8 weeks. Yeah.
Walang buy one, take one.
That's for the patient access program. So that is the information na we are also sharing po dun sa group namin, how they are sourcing their medicines, ganyan. So sa government po, ang nakukuha po namin currently is guarantee letters from the SWD, PCSO, Office of the President. So yan po yung mga pinaka-common. But it's not always that you can get. Pero malaking bagay din siya.
Anong proseso para makakuha ng guarantee letter?
You have to submit the documents po and then you go to the office. Like may list naman sila like the PWD ID, medical abstract, the quotation. So yun po. Isa-submit lang and they will give naman po. And then we're also accessing po yung patient access programs po nung mga pharmacy companies. So, they offer po, for some medicines, depend po kasi kung anong medicines eh. So, some they have buy 2, take 1, buy 1, take 1, and then some they have a program for 8 vials, ilan lang yung sasagutin mo. So, yan, depends po. But we are hopeful po na one day parang magiging inclusive po yung coverage din for
Kasama
IBD.
na sa field, sa gamot, no?
Yun nga, no? Kasi parang yung guarantee letter, pipila ka pa eh.
Oo.
Diba?
Matrabaho talaga, no?
And alam natin nga, no, medyo questionable yung guarantee. Hot topic ang guarantee letter na yun. Kasi may politika involved yan. No?
That's the unfortunate setup with our healthcare system. So, I mean, I know that people rallied for yung 1 trillion peso something in EDSA. Sana hindi makalimutan ng mga tao na parang, you know, this IBD thing is a very real lived experience for many patients. And if you're not, even if you're actually rich or middle class or something, malaking bagay pa rin yung 500,000 pesos a year. And that's the minimum, like every 8 weeks is the minimum. We still
Minimum
sometimes
lang
need
yun.
to escalate to every 4 weeks. So every month, to maximize, you know, the effect of the drug on you, we can still double the dose. We can give it at every 4 weeks. So, you know, parang other countries, like I know that we're a developing country, but other countries they will cover this through their equivalent of PhilHealth. At tayo, wala, hindi naman, you know, we're not like that.
Hindi
So
pa ganon.
yeah, so
Hindi pa,
parang,
hopefully.
but there are ways. The pharmaceutical companies where we source the medicines from, they have access programs, yung buy 2, take 1, buy 1, take 1. Then there are also ways to yung access yung guarantee letters depending on the politicians. You know, wink, wink. But there's may mga paraan. Like you just have to be. Unfortunately, kayo magtatrabaho, but that's what the goal of like the support groups to try to help one another. You know,
Pero
go through the
maganda
process.
may buy 1, take 1, buy 2, take 1. Pero yun lang, no, mahirap
Hindi siya
kung wala kang
sustainable
pambili ng buy 1.
Oo.
Di ba? Kung wala kang pambili ng buy 1, zero ka, di ba? So kaya importante din talaga na may advokasya tayo.
Correct.
No? Yes, Miss Anne, may gusto kong...
If I may add po, no, kasi meron din kaming mga groups, members po dun sa group na they are OFWs or they're living in other countries. So they are sharing po na sa kanila covered yung mga ganitong treatments. They were able to sustain. So, minsan pagka may mga OFWs po na nagbabakasyon dito, sasabihin nila, ay, kailangan ko nang bumalik kasi doon ako makakapagpagamot.
Oo nga. Meron ba tayo, Doc Mark, or at saka Ann, kung may narinig din kayo, meron ba tayong mga ibang ways of treating? Like, halimbawa, may effect ba yung food? Kasi marami nagtatanong or about this particular kind of diet, mga na-carnivore diet, mga nauuso. Anong stand mo doon, Doc Mark?
And Doc TP, may question din si Kiel Maglalang, no? Parang kung sobrang mahal ng mga medicines, meron bang alternative options din na mas affordable? Gaya ng, what are your thoughts daw, no, Doc Mark, about KPV peptides?
Dali, di ba mahal din yata yung peptides na yan?
Very controversial din ang peptides, no? So,
unahin ko muna yung food.
So, food
Tignan
and
muna
alternative
natin.
treatments.
Sige, Doc Mark.
So, in order for the doctor or physician to say na something is effective, na pag-aralan siya in an experiment. So, they have done experiments, what we call them clinical trials on diet, adjusting, you know, certain diets. They only work, there's only a specific type of diet that works on pediatric yung mga bata, yung exclusive enteric nutrition, but that's only for 8 weeks, just a few months.
Di ba pangit lasa nun?
Liquid lang talaga yung iinumin mo for like every day. So that's not sustainable in the long run. regarding a carnivore diet or whatever diet, they have been studied and none of them have been shown to be
pati
effective.
mga low FODMAP diet,
So
naririnig din natin.
that's for IBS. IBS, but they can also be for IBD patients because sometimes some patients can have IBS on top of IBD.
So pwedeng sabay.
Pwedeng sabay. And then basically if the patient if you're able to access the biologics, no, and then you're well, what we will say is you can eat anything you want except for the processed food, the usual bad stuff. So
bawal pa rin yun.
Bawal pa
Kahit
rin yun.
naka-biologics ka,
Yeah.
healthy food pa rin.
Healthy food, but the usual healthy food. There's no specific diet that we will necessarily say.
So yung sinasabi ng DOH na healthy plate, yun pa
Yeah,
rin yung
the My
gusto
Plate,
natin.
yung-
My plate,
Yeah.
Mediterranean diet, yun pa rin.
Ako gusto kong tanungin si Miss as patient advocates, parang ang laki din ng role ninyo when it comes to promoting these positive behaviors and even like life hacks, no, to the members of your community.
Life hacks?
Oh, kasi di ba parang yun yung value
Mga
din ng
tips
ating
nila.
mga online health communities. Parang tips, parang on top of what of course their doctors would share as well. So, ano yung mga kadalasan yung tinuturo na life hacks or words of wisdom and advice to the members of your community in terms of both prevention or like management of symptoms?
Yung sa tips po, they share usually ano yung diet nila. But we all know naman po na different patient, different triggers. So, we can only share as much but depends pa rin sa'yo. Ano yung magiging okay sa'yo. With the shared experiences po, they are sharing success stories. So, para ma-uplift yung spirits po ng mga IBD patients. Kasi lalo sa mga bagong diagnose po, when they hear stories ng mga patients na matatagal ng diagnose and they are living with Crohn's disease, so sinishare nila na okay naman ako, naging okay naman ako, I was able to get back to my life. So, ayun po, okay naman po yung nagiging response nung team. So kapag ka merong may gustong magtanong, nakapagtanong sila doon. And then sasagot yung mga merong pwedeng ma-share doon sa topic na tinatanong po ng mga members.
Thank you very much, Ana. Actually, medyo nagpapanik kami dito ni Doc Jello kasi malapit nang mag-end ang ating show.
Pero napakarami nating napag-usapan, no?
Oo nga. Pero sobrang masterclass talaga tong napag-usapan natin ngayong gabi. So maraming salamat, Doc Mark at saka Ann, no? Parang grounding us into, ano ba yung reality talaga ng IBD. Pero siguro, bago tayo magtapos, any last messages siguro muna kay Doc Mark muna para sa ating mga tagapakinig?
I think IBD is not a death sentence or it's not something that's hopeless. I know that even if we can manage it, I know that one part that makes it hopeless kasi in the Philippines is access to the therapy. Sobrang mahal talaga. But I think we're in the process of, being aware. More doctors are being aware. More doctors are made aware. Patients are aware. Their support groups. So hopefully we can move forward with supporting patients in terms of their treatment. Don't lose hope. Don't lose hope. That's what I would say.
Ganda naman yan. Oo.
And Anne, how about you, no? Parang may mensahe ka ba to your fellow patient survivors ng IBD?
So, yes po. Una sa lahat po, I admire all patients who are very resilient in facing this condition, and also the family members who are journeying together with us. And to all the silent sufferers po, if you think you have IBD, get yourself diagnosed. And to all those patients na diagnosed na ng IBD, you can reach out to our page po, our Crohn's and Colitis Patient Support Group. So you can check our social media pages po. And yun po. Thank you very much po for this platform po to raise awareness IBD.
Napaka-empowering ng iyong message, Ann. Maraming salamat. So, thank you so much for your time and expertise, Dr. Mark Chatto. And thank you, Miss Ann Gayanilo. Tama yung pag-pronounce ko? Yes, para sa iyong pag-represent sa ating community. Na-feel namin yung heart, na-feel namin yung love, at saka yung passion mo for the work that you're doing, no? So, you have truly armed our listeners with life-saving knowledge ngayong gabi. So, maraming salamat sa inyong dalawa.
And also thank you very much to our listeners who participated actively in
dami,
our
hindi
conversations
na natin
here at Cura.
lahat
So,
ngayon.
pasensya na po sa mga hindi nasagot na mga tanong, but hopefully this episode was as informative and as empowering as it was for us as
For
well.
us, dami ko natutunan, no?
And Dr. P, once again, as we close this episode, we want to reiterate that today, May 19,
Hindi pa ngayon.
on May 19, rather, di ba, is World IBD Day to every single member, advocate, and family connected to Crohn's and Colitis Philippines. We see you, we support you, at hindi kayo nag-iisa, and never lose hope, sabi nga ni Doc Mark. So, please feel free to reach out to your community because support will always be available for you for as long as you ask for it.
Magbabay na tayo.
Yes.
Ikaw muna.
So, ayan po, no? Maraming salamat po, no, for tuning in with us. Thank you very much, Doc Mark, Miss Anna. I am Dr. Jello Apostol.
So, thank you for joining us in this deeply important conversation. So, stay informed, listen to your gut, and advocate for your health. I'm Dr. Tipi Sumpayco Tanchanco, and this is Cura, empowering you with care, health, and healing. Magandang gabi po sa inyong lahat.
Health isn't just about medicine.
It's about care,
Community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing,
Hope, and health right here on
Radyo
Katipunan 87.9 FM.
Cura, your campus health companion
Where care meets conversation.
Radyo Katipunan. News, insights, inspiration. Radyo Katipunan. Down from the hill and down to the world. Radyo Katipunan. The voice of the Blue Eagle.
How lovely is your dwelling place, O Lord, mighty God, Lord of all. How lovely is your dwelling place, O Lord, mighty God, Lord of all. Even the lowly sparrow finds a home for her brood, and the swallow a nest for herself where she may lay her young. In your altars, my King and my God. How lovely is your dwelling place, O Lord, mighty God, Lord of all. Blessed are they whose dwelling is your own, Lord of peace. Blessed are they, refreshed by springs and by rain, when dryness daunts and scathes. Behold my shield, my King and my God. How lovely is your dwelling place, O Lord, mighty God, Lord of all. I would forsake 1,000 other days anywhere if I could spend one day in your courts, belong to you alone. My strength are are you alone, my glory, my King, and my Lord, mighty God, Lord of all. How lovely your dwelling place, O Lord, mighty God, Lord of all.
As our day comes to a close, let us put ourselves in the most holy presence of God. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. May He support us all the day long, till the shades lengthen, and the evening comes, and the busy world is hushed, and the fever of life is over, and our work is done. Then, in His mercy, may He give us a safe lodging and a holy rest and peace at the last. Amen.